Hello, welcome to this brief tutorial about search for and collect the most relevant best evidence. As you know, nowadays information is constantly developing. Finding it is complicated with numerous textbooks, summaries of evidence, guidelines, and thousands of primary studies. Too much information, databases, and resources, but we don't have too much time to find the most updated information. Evidence information services and resources have continued to progress. And Alper and Hein proposed to use the 5S pyramid model approach to search for evidence. As you can see here in the slide, this model consists of 5 levels from the top with the systems to the bottom with the studies or primary studies. Each of these levels should build systematically from lower levels and provide substantially more useful information for guiding clinical decision-making. Ideally, the recommendation is to start your search from the top to the bottom of the pyramid. In the top of the pyramid, system provide patient-specific evidence-based computerized decision support at the point of care. Many systems are under construction, so they are not available yet. In the second level, summary clinical test provide the best summarization of evidence for clinical decisions for entire clinical topics like diabetes or asthma. We can find specific resources like best practice in AMID or EBP guidelines are up to date. In the third level, you can find systematic guidelines or clinical practice guideline. These documents provide evidence-based recommendation for clinical care for a specific aspect of topics. And many of these clinical practice guidelines are sponsored by professional organizations and governments. In the fourth level, you can find systematic reviews that they are detailed and exhaustive summaries of evidence on a specific clinical question. Synthesis combining multiple original reports. And Cochrane database of systematic reviews is one specific resources to find these systematic reviews. In the bottom of the pyramid, you find studies or primary studies. So when none of the upper layers of the pyramid provide an answer to your clinical question, you must look for individual studies. Here you will find original investigations into the diagnosis, treatment, prognosis, or prevention of specific clinical disorder. So please learn about the most common and useful resources and databases and start your search.